Asthma is a chronic respiratory condition that affects the airways in your lungs. It affects millions of people worldwide, regardless of age, gender, or ethnicity. Asthma makes it hard to breathe, especially during physical activities or exposure to certain triggers. This is due to inflammation and narrowing of the airways, which can cause coughing, wheezing, and shortness of breath. The airways are like tubes that carry air in and out of your lungs. When you have asthma, these airways become sensitive and can react strongly to various triggers. These triggers can include pollen, smoke, pollution, or even cold air. They react to certain triggers in the environment, causing the airways to tighten and swell. Asthma can range from mild to severe, with symptoms varying from person to person. Some people experience symptoms only occasionally, while others may have frequent and debilitating attacks. Severe asthma attacks can be life-threatening and require immediate medical attention. Understanding asthma is the first step towards managing it effectively and improving quality of life. During an asthma attack, the lining of the airways becomes inflamed. This inflammation causes the airways to swell. The swelling makes the airways narrower. As the airways narrow, it becomes difficult for air to pass through. This leads to the common symptoms of asthma. These symptoms include wheezing, coughing, shortness of breath, and chest tightness. The muscles around the airways can also tighten. This further restricts airflow. The combination of inflammation, mucus production, and muscle tightening makes breathing a struggle. Asthma triggers vary from person to person. What might cause an attack in one individual could be completely harmless to another. Common triggers include allergens like pollen, dust mites, and pet dander. These tiny particles can easily enter your airways and cause inflammation. Irritants such as tobacco smoke, air pollution, and strong odors can also trigger asthma. These substances can irritate the sensitive lining of your airways. Other triggers include respiratory infections, exercise, cold air, and stress. Each of these can cause your airways to tighten and make breathing difficult. When you encounter a trigger, your airways react. They become inflamed, swollen, and filled with mucus. This reaction leads to the symptoms of an asthma attack, such as coughing, wheezing, and shortness of breath. It is important to identify your individual triggers. Keeping a diary of your symptoms can help you pinpoint what sets off your asthma. Knowing your triggers helps you to avoid them. This proactive approach can significantly reduce the frequency and severity of your asthma attacks. Avoiding triggers is key to preventing asthma attacks. By taking these steps, you can lead a healthier, more active life. Asthma is a manageable condition that affects millions of people worldwide. With proper treatment and lifestyle adjustments, people with asthma can live normal, active lives, enjoying activities they love. Medications are crucial for managing asthma effectively and ensuring that symptoms are kept under control. There are two main types of asthma medications: relievers and controllers, each serving a specific purpose in asthma management. Relievers, like albuterol, work quickly to open up the airways during an attack, providing immediate relief from symptoms. Controllers are taken daily to reduce inflammation and prevent attacks, helping to maintain long-term control over asthma. Identifying and avoiding your triggers is equally important in managing asthma effectively. Keep your home clean and free of dust mites, as these can be common asthma triggers. Avoid smoking and secondhand smoke, as these can significantly worsen asthma symptoms. If you have exercise-induced asthma, warm up slowly and use your reliever medication as directed by your doctor to prevent symptoms. Managing asthma is a partnership between you and your doctor, involving regular checkups and open communication. By understanding your condition, taking your medication as prescribed, and avoiding your triggers, you can live a full and active life, enjoying the outdoors and staying healthy.